Good morning. If you have decided to study to become a professional hypnotherapist, keep watching our training videos on hypnosis. Hypnosis is a powerful technique with which you can help and improve the quality of life of a large number of your future patients. Remember, read the description of this video, where you can find a link to free training classes on clinical hypnosis. And in addition, you can download several ebooks also free. Let's look at regressive techniques in direct clinical hypnosis. First, introduction. Second, regressive therapy. 3. Basic principles of the therapy. 3.1. Transfer. 3.2. Pulling the thread. 3.3. 6 phases in the regressive therapy. 3.4. 3 important phases. 3.4. 3 important phases. 4. Regressive map. 5. Framing technique. 5.1. Examples. 6. Aspects to take into account in every therapy. 6.1. Examples of sentences and questions that can be asked. 7. Involve the patient in the therapy. 8. Common features throughout regression. 9. Summary. And 10. Hypnotic induction. Introduction. Past life regressions are used to alleviate behavioral conflicts, reduce anxiety, to solve traumas where we do not find their origin in the present life, and to expand the field of consciousness in the present existence. The regression to supposed past life is the most suitable technique to go into the depth of the unconscious of the human being. Reincarnation is one of the oldest and most deeply rooted religious beliefs of mankind. We must keep in mind that regression is a tool to solve problems where other hypnotic methods have failed. In the clinic, we will use regression therapy, always under the therapist's approach. That is, we use hypnotic regression to a supposed past life as a technique or practical method to carry out a psychological healing in the patient. We will never question the veracity or not of reincarnation. That is a matter of belief, and we must respect the beliefs of others. It does not matter if reincarnation exists or not. What matters is that the patient is cured. The important thing is for the patient to solve his problem and not to question the veracity or falsity of the supposed other lives. In the regression, the patient can present adverse or disturbing emotions. Hence, the importance of knowing how to guide the patient adequately in his regression. To prevent the patient from entering these emotions, it is advisable to insert a key word in the patient, which acts as a key to automatically enter a state of calm and tranquility. If the experience is highly emotional due to the scene relieved in the regression by the patient, and we believe it is convenient to continue with this experience, we'll make the patient visualize it dissociated, that is to say, as if they were watching a film. When we think it is necessary and we have enough clinical experience in knowing how to guide the patient correctly in his regression, we will make the patient relieve the regression, as if it were happening again, that is to say, reminiscence. Through a very deep state of hypnosis, we try to transfer from the unconscious to the conscious traumatic events that occurred in the patient's present or past life, which at the time provoked reactions or symptoms that under similar circumstances reappear in his present life. In regression, the patient relieves the experience, feeling again all the emotions of that moment. The release of these emotions, the examination of the recovered material, and the review of the situation from the current perspective are an important part of regression therapy. Finding the cause of the trauma does not necessarily eliminate it, but the patient understands it and begins to feel free of the emotion that was dominating him or her, free of a destructive pattern of behavior. If you are interested in learning more about clinical hypnosis, please watch our next video. regressive techniques in hypnosis. Remember, read the description of this video, where you can find a link to free training classes on clinical hypnosis, and you can download several free ebooks. If you have any questions, please add them in the comments area. We'll talk about this topic and many others on the channel and in the videos that we will publish. So if you're interested, do not miss our next videos. Thank you very much.